Hello, everyone. Welcome to another week of Quarantine World, where this week we're going to talk about the failures of media. Well, failures of media are part of it, but let's provide some background. First and foremost, we have been in this lockdown for a couple months now. Several weeks. We are facing a virus that scientists around the world still have not fully gotten their heads around, which is fair, to be honest. But while scientists are hard at work trying to provide treatments and vaccines for this, we are also facing a media hard at work, confusing information for the consumption of the general public. And the largest way that they are providing this confusing information is by obscuring the line between opinion and fact. This should come as no surprise to anyone, but regardless, it needs to be flat out explained. The media does not properly differentiate fact and opinion. Let me explain. First, we will touch on this Vox article. The White House has two testing standards. One for Trump and another for everyone else. They say it's nonsensical for everyone to get tested, with exceptions for anyone who crosses paths with Trump. Notably written by Aaron Rupar. That becomes important later. Unlike many Americans who are worried about contracting or spreading the coronavirus, President Donald Trump has yet to be seen in public wearing a mask. He even went without one during his visit on Tuesday to a Honeywell facility in Arizona that otherwise requires them. The White House's flawed rationale for this is that Trump doesn't have to, because he and everyone he comes into contact with is tested for the virus. Now, as you notice, this flawed, in parentheses, exists. I'm curious as to why or what the proof could be to this flawed rationale, since it is in typical fashion that a news agency links sources for their citations in articles. So, we click and we are brought to, interesting. Aaron Rupar's own Twitter post, in which all he says is, coronavirus tests are not 100% accurate. 2. Pence could contract the virus between tests. 3. How about showing some leadership? Now, this does not really suffice as to explaining one's assertion for flawed. I mean, there are no citations here, just words in a tweet, regardless of whether or not he may be correct in his assertion that tests are not 100% accurate, which, let's be fair, few things in this world are. It takes a certain type of ego to cite yourself as a source in an article without being an accomplished scientist with multiple published works. By the way, he does it again in the middle of the article, which I find hilarious, but at least that time he posted a video of people saying words. Congrats on having at least a modicum of fucking respect, Aaron. The article continues. In this respect, the White House is operating with one safer standard for officials and another less safe standard for the warriors Trump is now urging to go back to work in the teeth of the pandemic. This disparity was put on stark display on Wednesday. The notion that everyone needs to be tested is simply nonsensical, Press Secretary Kayleigh McEnany said during Wednesday's press briefing, in response to a question from NBC's Peter Alexander about why all Americans shouldn't be able to get tested like the president before they go back to work. See, this is technically true. This quote, but it's lacking context. The point the press secretary was making, and the video is linked below and timestamped for your pleasure. The crux of Press Secretary McEnany's statement was that simply if you test every American now, you would have to test them again when they come into contact with another person. Simply put, there's no feasible way to ensure that you are, quote-unquote, clean, like a zombie apocalypse where people check if you've been bitten by a zombie. This thing could get you when you leave a testing facility for all you know when you touch a door handle. Further down, the author does admit this, but it continues into a much more opinionated statement. He says, not only is the U.S. nowhere near conducting the 20 million tests a day that Romer, an economist, recommends, but we're nowhere near conducting the 500,000 or so that experts who are more modest about testing think is necessary to safely reopen business. Right now, on a good day, the U.S. is conducting about half that, or 250,000 tests, according to information gathered by the COVID Tracking Project. Trump is not interested in engaging with this problem. He's regularly contradicted public health experts in his own government by insisting, falsely, that states already have more than enough testing capacity to reopen businesses and schools. But the reality is there hasn't even been enough tests for all 100 U.S. senators to be proactively screened or for professional sports franchises to procure them. And whoa, look at what we have here. We have more links. Well, let's look into that. Several U.S. senators have urged congressional leaders to accept the White House's offer of rapid coronavirus testing for lawmakers, saying they could otherwise unwittingly spread the disease when they return to their home districts. Senate Majority Leader Mitch McConnell, a Republican, and Democratic House of Representatives Speaker Nancy Pelosi issued a rare joint statement on Saturday, declining the offer for 1,000 rapid coronavirus testing kits, saying those were needed for frontline workers fighting the virus. Alrighty then, so that first statement is objectively false because it's not that the White House couldn't, it's that the Senate and House voted down the offer. Following the other links takes us to Bleacher Report, and as we scroll on down, we find something interesting. ESPN's Adrian Wojnarowski added that other franchises also share Cuban's concerns regarding the inability to test asymptomatic players. Without widespread coronavirus testing available to the country, NBA remains sensitive on using tests with players showing no symptoms entering facilities to start workouts. If or when NBA opens camps for formal return to play, there's an understanding testing protocols would change. Now, what was it that he originally said? Sources: as some practice facilities become able to reopen starting Friday, teams are still instructed not to test asymptomatic players for coronavirus. For now, NBA's informed teams of updated measures on cardiac screening for certain players prior to voluntary workouts. So you've been asked not to test asymptomatic players. Not that there aren't enough testing, but someone asked you not to. Weird kind of situation. I wish I could find out who asked them not to. Looks like the NBA itself has asked. Let's delve deeper. The team-wide testing came at a time when communities still had trouble getting kits and testing had yet to ramp up. New York Mayor Bill de Blasio tweeted, "We wish the players a speedy recovery, but with all due respect, an entire NBA team should not get tested for COVID-19 while there are critically ill patients waiting to be tested. Tests should not be for the wealthy, but for the sick." You know, for New York, I can almost understand that. So they were asked not to test by the NBA at the behest of politicians representing hospitals. Okay, I think that's a fair assessment. Something does rub me the wrong way looking at de Blasio's post, though. There are critically ill patients waiting to be tested. Are there? Are there really? That's crazy. The reason I'm so critical of that statement is, well, this article from NPR, eerie emptiness of ERs worries doctors. Where are the heart attacks and strokes? Where are all these patients? Across the country, ER volumes are down about 40 to 50%, says Dr. William Jacques, president of the American College of Emergency Physicians. I haven't seen anything like it ever, he says. We anticipated actually higher volumes, but doctors say once busy emergency rooms have slowed to an eerie calm. It was very scary because it was so quiet, says Dr. David Tashman, medical director of the ER at USC Verduga Hills Hospital in Glendale, California, about the early days of the outbreak. We normally see 100 patients a day, and then overnight we were down to 30 or 40. Some of that decrease is normal patient volume was deliberate. As hospitals prepared for a surge of COVID-19 patients, officials advised people to avoid emergency rooms if at all possible. Tashman says he wasn't surprised to see fewer trauma patients because the roads were emptier. But soon, he and other ER physicians noticed that even truly urgent cases were not coming in. We know that number of heart attacks isn't going to go down in a pandemic. It really shouldn't, Tashman says. Dr. Larry Stock, an ER doctor at Antelope Valley Hospital in Lancaster, California, wondered the same thing. I mean, we've all been scratching our heads. Where are all these patients, Stock says. They're at home, and we're starting to get ... the tip of the iceberg of this phenomenon. Now notice the ellipses there. I'm not so sure that's the whole statement. Just take that into consideration. But all these things considered, what do we have here? California and Washington doctors have less ER calls. Now, why would that be? Is it because people are in their houses and are less likely to get into situations that would require a visit to the ER? Maybe. Is it like the article described, and because the media has warned people to avoid hospitals to make room for all the COVID patients? Also possible. But as that NPR article goes on, it details that this is nationwide. Florida, Connecticut, and even Texas are seeing declines in people showing up to the hospital. See, this is the danger of media fear-mongering. And you know what? Not even just the media, but politicians as well. Irresponsible messaging has created an environment where people are in their homes, terrified to leave, terrified that if the world opens up, everyone will die. I'm not even kidding. But that is a rant for tomorrow on the Political Recap on Moisky Live at 9:30 p.m. GMT or 4:30 p.m. EDT tomorrow. I thank you all for joining me. Leave your thoughts down below, like and share if you think I deserve it or if you think I don't. And I will see y'all soon.